welcome, Queen.
The explosion of the Welcome to Vibes and Cahé, episode number?
9. Sebastian, just in
English
case.
is 9.
Because he doesn't know Italian.
Today we're at the lot in North Parramatta. Little
North
cookie
Parramatta.
with the coffee.
But your lid's on today. What's going on, Coach?
Well, it's not actually going to stay on. It's because I was holding the
because
cookie.
you've got to have the cookie
But-
first and into the lid.
Can't go wrong.
Oh, wow. You can't even see it in the camera.
Look at the crema. Namo spill. Can't show. So today's episode, we are discussing
Sideline care.
so,
Best experiences, worst experiences.
Oh yeah. Anything else?
Funny
Oh
experiences.
yeah. Any other experiences? Let's start with worst experiences. What's the worst thing you've seen on the sideline?
Oh, there's got to be a few. Seeing an ACL is never nice, man, to be honest. Seen a few of those now. Classic sort of pivot shift mechanism where they're sort of coming in, knees bending in, and all of a sudden they're screaming in agony.
Yes, disgusting.
In that sort of
So I
fetal position.
had a bad one once where I got called from in the change room to run outside, jump the fence, and they're like, his neck, and I'm thinking, I hope he's not bad. And I move his shirt down, and his skin is just like got a bone just protruding almost through it, and I remember looking at it and almost vomited, and I had to like calm it down, like, okay,
not the best.
we're going hospital.
I think for me, actually, last year, good experience, UBF podcast. Here I am going to the charity match. Rob goes to me, oh, man, we've got this little charity match, go there, have a look at it, like just treat some of the boys, all good. So yeah, no problem. All of a sudden, little charity match turns into Tari George does his ACL.
It's a big one, eh?
Fucking hell.
Didn't another guy do his shoulder as well?
Yeah, so Isaac eats a lot. Dislocates his shoulder. And they're never good to see it, the dislocations.
That's why influencers don't play football, eh? That's why influencers don't play football.
That was wild.
What about best experiences, Coach?
Best experiences? Are we talking like from what you get out of being on the sideline?
A bit of both, yeah, why not?
I think, first of all, culture. There's nothing like a change room environment. So I think that's unbelievable from an experience standpoint. But in terms of what I think it gives us or clinicians and so forth is skill set, so hands-on therapy, obviously that quick diagnosis. You're going out there, you're seeing potentially some pretty severe and serious injuries. You don't see that in the clinic, so I think that sharpens skill sets up.
Yep.
What about you, man?
Oh no, hey, it's the banter. It's bullying.
Yeah, that's the...
My tongue is so much sharper from bullying linesmen.
From the linesman?
Yeah.
Mate, we had a linesman on the weekend, actually 2 weeks ago.
Oh no.
He had a headband on. But it was a 40.
Oh.
So he's not even running. I didn't quite understand.
No.
People told me he actually reffed the 20s game, but he kept the headband on for first grade, yeah. So.
Yeah, I'm an attire judge, the mediums and the short longs and long shorts. Yeah, can't. But I love the banter with the boys on the sideline, to be honest. That's my favourite part of doing sideline work. Obviously, you have a lot of skill sets that you learn on the sides, and I love it for like where we have our students who have now become clinicians. Often they started off on the sidelines and treating players, coaches, parents,
and their banter's
parents.
getting sharper too, unfortunately.
Yeah, their tongue gets sharper too when they hang around it long enough.
Get a bit chirpy.
Yeah. What about funniest Googe?
Okay, I got one from a few years ago for you.
Yeah, go on.
So, 20 minutes into the game, guy goes down, one of our players. Not going to name who this is. Anyway, I run out onto the pitch, and I said, mate, what's wrong? He goes, Hooch, help me, I need help. I need to go to the toilet. And I said, no offense, bro.
Here you go, bro.
What do you want me to do? Coach, he's got to go to the toilet.
So you got subbed?
He got subbed off, he was gone.
For number 2?
He was done.
Oh my
was all
God,
over.
wow.
Game done.
That's
couldn't handle it.
disgusting. That's so funny.
He couldn't sprint, Coach.
Oh my God. That's cool. I've had a couple of funny ones where I think the one that always makes me laugh is like time wasting. Players want to time waste and use the physio as the time waster.
100%.
So I run onto the pitch, someone's holding their ankle,
3
physio
points,
come
3
on,
points.
I come across, what's wrong? They'll be like, oh, nothing, just do a few tests. So I'm like, oh, we're doing that right now, you know, and I'll do all the ankle tests, and then I'll run out of tests, and I'm like, all right, what do I do now? Maybe I'll test the knee. Start testing the knee. Other kids from the opposition teams will be coming over, ref, he's not even touching the right area.
It was his hip.
And the time wasting becomes a conversation with their players. Excuse me, mate, are you a physio?
Let me do my job.
Let me do my job, you do your
right.
job. Please step away.
Then the refs get the shit.
Yeah, ref, do you mind moving these guys away so I can do my job, please?
100%.
You know, you start that conversation, slowly walk them off.
But you got to be intelligent, because if you go on, that player's got to come off.
Yeah.
Now they're down for 10 men.
That's right.
So if they get a yellow card, different
Actually, I had a ref abuse me the other week because I asked him that. I came on for an injured player, and I asked the ref, I said, is it a yellow card, sir? And he goes, mate, that's not your job. You worry about your own job. And I'm like,
wow.
I need to know so I have to bring this player off or leave him on the field, mate. I am trying to do my job. You're inhibiting me. And one other funny one I had was post ACL op. You hadn't cleared me to run yet, and I was covering a game. It was a semi-final, and a kid got injured on the other side of the field. So then they're like, oh, physio. So I start hobbling across, or like, you know, little speed walk, you know, swinging the hips a little bit, little suavemente. All their players, hurry up, physio. Why? Like he can run.
And I'm wasting time.
I actually can't run. I'm as injured as him.
Oh my god.
But yeah,
they're the best. Yeah, they're the funny ones, man. And then you're getting abused from the crowd. He's not even dead. He's not even injured. Get him off the pitch. It's anything for the 3 points, but
that's right.
You know, so tactically, sometimes we have to, you know, is that player all right? I'm not going on, because if he's coming off, we're in trouble down 10 men. So.
And the other hard thing about sideline work is is you have to make split decisions at the time.
Yeah,
and sometimes you can get some wrong ones. You know what I mean? Like personally, I know I had a wrong one once where I call it wrong. It was I think a 38-degree day, pelting, like sweating bullets. You know, and a kid's like,
did you have your shirt off?
I wish. No, they rolled up the sleeves. But I was trying to get the tan line up here at least. Not often you see me with a shirt on, but I had one on.
True.
And I remember the kid like thought he may have popped his shoulder out, like subluxed it. So I've done a few tests and I got maybe a false negative, and I was like, oh, maybe it seems okay. Can you move it? Yeah, no worries. Everything seemed fine on testing. And I said, look, I would normally strap this. However, you're drenched. I'm like, no tape is going to stick to you. So it's up to you if you want to go back on the field, but I probably wouldn't suggest it, especially at this time of the year. It was still pre-season. He sort of said, oh, I think I'll give it a go. All right. Went back on. Within 3 minutes, he's gone in behind, threw on goal. Shoulder popped out with an arm swing. No. It's come off. He's like, why don't you strap it? And I'm like, what could I have done to you? Like, how could I have attached your shoulder?
You should have strapped it
around the whole body, keep it in here.
Yeah, they're tricky.
Any tricky ones? Concussions?
Concussions.
Wasn't there one of those you had?
Yeah, concussion tricky. A couple last year. Yeah, very, very tricky actually, where players are passing testing initially, and then within a few minutes of time, they're actually completely out of it, completely dazed. So
delayed effects.
Those delayed effects of concussions can be quite tricky. I think you need to know your players and how they react to certain situations, and if in doubt, obviously sit them out. But yeah, they can be quite tricky, especially when it comes down to the intensity of the game, the type of game it is, and all the rest of it. And you don't want to just rule out anyone just on the basis of nothing at all.
Yeah,
but at the same time, safety first. So they're the ones that can be quite tricky to be
very
fair.
tricky.
Yeah. And players often in those situations are going to tell you to get, you know what, because they want to keep playing. So
very true.
It can be tricky, yeah.
Well, anyway, that concludes episode number 9, I believe. So in summary, concussions, poos, shoulders popping out, ACLs for celebrities. But yeah, sideline has a lot of random things that you see live, and I guess in clinic you see it 3 days later. But when you're on the sideline, that's when it's
rapid
raw.
Assessment, mate.
Yeah, you learn a lot.
Oh yeah, you learn very quickly, good and bad.
Well, coach, cheers.
Lid on.
Lid off, mate, and pinky up.